Stabilometry, test execution and acquisition technique. The use of the pressure platform in posturographic mode allows us to perform a series of stabilometric exams through the study of the movements of the center of pressure, more commonly called COP. The stabilometric exam can be performed both in bipodalic and in monopodalic position. The software also suggests a series of preset analysis protocols, which in turn can be adjusted according to our needs. Following the classical literature, let us place the patient on the platform with his feet in the Romberg position. That is, separated by 2 centimeters at the heels and aligned, with the pedalic axes extra-rotated 15 degrees, with his arm down at the sides and face forwards. For the carrying out of the monopodalic stabilometry, we will ask the patient to lift 1 foot from the ground, remaining resting on the contralateral one. The arms may be abducted in case of unstable individuals or folded on the chest.
Room light and noise conditions can affect the test. A fixed and constant noise from one side of the room can make the test of little use to the postural analysis. The feet position is still a much debated aspect in the scientific environment. In fact, the Romberg position may not be very comfortable for patients, but it is the easiest to standardize, thus making each exam comparable with the next one.
The suggested duration for the stabilometric tests is 51.2 seconds for the bipodalic postural test and 10 seconds for the monopodalic test. After positioning the patient on the platform, we can start the data acquisition, after which we can safely close the test that will automatically be saved on the database. Posturography, data reading. Among the main data of the stabilometric exam, we will find the stabilogram study, namely the overtime trend of the center of pressure movement on the horizontal and on the anteroposterior axis. The study of the status kinesiogram, namely the trend of the COP movement on the horizontal plane. The study of the area of the confidence ellipse of the path drawn by the COP on the horizontal plane.
Among the parameters to take into greater consideration, we must certainly mention the confidence ellipse area of the COP path, which is around 1 square centimeters wide, with open eyes, and no more than 2.5 square centimeters with closed eyes.
The length of the COP path, the movement speed, the study of the movement frequency, and the study of the oscillatory components and of the oscillations of each right and left centers of pressure compared with the COP oscillation.
The interpretation of the stabilometric exam is undoubtedly advanced. For this reason, it seems very practical to review the exam in its microdynamics through the kinematic function of the software that allows to view a video composed of all frames collected during the measurement.